yeah, they're essentially lengthening the fascia and maybe the muscles somewhat. Muscles don't really lengthen, the muscle fibers themselves don't lengthen and shorten. So it's, I like to think of it more as fascial work, but, and people have an erroneous idea of it being, it can be painful, but have you been rolfed? But
Once, maybe.
it's not a long-term painful thing. It just might be like, oh, that kind of hurts. And then as soon as they're done with that section, holy cow. For me, I'll speak only for myself. When I went to Maryland for the first session, she worked to go through a series of 10 sessions. And they're all, no matter where in the world you go with a rolfer, you get the same 10 series. Wouldn't matter what's going on with your body, essentially. So,
isn't it progressive from the ground up?
yeah, they start with your feet, but they always also address your kind of your head and neck in every session too. But start with your feet. By the time she got to about my little above my knee, maybe this is kind of my calf, I felt like she poured warm honey into my foot, and it was traveling all the way up into my upper body. And I told her, she's like, oh, that's good. That means your fascia, she says, it means your fascia's hydrated. It means your body is ready for this. Your energy, you're feeling the energy of this change. And I just was in heaven. And then she did the other leg, the same thing happened. So by the time I left that one, I felt like I died and gone to heaven. So that doesn't mean it wasn't painful some of the times. That particular session wasn't painful. But they go, after the third session, they go deeper, and then it can get painful. But the relief is way worth it, in my book.
To me, it always feels like it's scratching an itch you could never reach.
Yeah.
You know, it's like getting in there to a place that you needed it. It feels like, oh, that's what I needed.
Yeah. Exactly. Even places where you think that there's no way they can possibly get to, like the iliacus behind the hip, or the subscapularis. I'm like, how did you do that? So yeah.
And we should just say one thing too, you're working with your practitioner as a partner, so you can always say, and you know, Suzanne is ready to ask me, how's the pressure? You can always say it's a little too much, it's kind of on the edge, you know, you want to work with your practitioner.
Okay, I'm going to just quickly go over a few of these things so we have enough time to take a little break before we get to work. So I already talked about this, but I want to talk about it again. So traumatic injuries to the shoulder include a blow to any aspect of the shoulder, front, side, back, fall on an outstretched arm, or a sudden twisting or wrenching. And I had a combination of all three when I first dislocated my shoulder. I dove in a lake, hit a rock, and my arm was outstretched, and it twisted it, and it just dislocated. So, overuse and repetitive stress injuries. Like I said, an injury to any one or more of these muscles can occur gradually from any repetitive movement, even if it's even if you're ergonomically set up. If the muscles aren't functioning correctly and you're ergonomically set up, you still could get a repetitive stress injury. And that can lead, the gradual stuff can lead to tendinopathy, where the tendons don't function, and tendinitis, and then, like I said, inflammation and fraying of the tendon, and that can ultimately lead to tearing. And then, so if that leads to impingement, you can end up also with bursitis, or adhesive capsulitis. So something that's not talked very much about is lost neuromuscular connection. So neurons that fire together wire together. There's some guy named Donald Heath who first used that phrase. And it describes how pathways in the brain are formed and reinforced through repetition. So repetitive thoughts and repetitive movements, that's neuronal connection. And so if we don't move enough, and that happens a lot with sedentary people, they don't move enough, and then they say, well, I can't lift my arm over my head anymore. It's not only because they're like weak or maybe you have injured, it's because the neuromuscular connection for that movement is lost. It's just gone to sleep. And so one of the things we do in posture therapy, particularly for the seniors that I get, is remind those muscles how to move. And sometimes they don't move very much in the beginning, but eventually they start moving and that connection is getting reestablished. And the more they do it, the better, the more it's going to happen. So yeah, this is, I would say in most cases, not involving permanent damage, because you could have stroke or some kind of nerve damage that's not true, but in most cases it's true. And then there's nerve damage that can happen from injury or disease, and even poor posture. You can develop nerve damage. So even though
grow back nerves too, right?
Yeah, nerves grow back slowly, but yes. Yeah. Unless they've been completely severed, I think. And even then, like I know someone who had a severed nerve, he restored some, he ended up with drop foot. He got some recovery, so I think something else came along and helped. I don't really know exactly that. So even though doctors are aware of poor posture as being a problem, and they might even say, you have really poor posture, you need physical therapy, whatever. It's never a diagnosis as far as I know. But it should be, because it is the root cause of a whole boatload of physical issues that we have, including circulation issues, digestive issues. I can't even think of the others right now, but yeah. So, a lot of people have shoulder injuries and they don't even know it. They have shoulder issues and they don't even know it. They function fine, some other muscles are recruited and they get along fine. So, that's another thing. The diagnoses that doctors usually give are impingement syndromes, and there are several types, and they're based on the name of the location. So, acromial, coracoid. They're not important to you, but they don't always tell you what you have. You just say impingement syndrome. And then the thickening of the bursa that I told you, that's bursitis, or thickening of a tendon, or irritation of tendonitis. Muscle tears, strains, and ruptures even. Cartilage loss and arthritis, which we haven't talked about yet, but we will. Bone fractures and degeneration, sometimes bad enough to warrant a partial or full replacement. And degeneration, of course, usually involves arthritis and cartilage loss. And then scoliosis is kind of its own thing in terms of the diagnosis. So physicians rarely, actually, I think only physicians who have either had personal experience with posture therapy or have had patients who have gone through posture therapy and they've seen the results are likely to refer people to posture therapy. So I reached out to physicians here and none of them have responded, although they do know. I know they've read my stuff. But I haven't gotten any referrals from a doctor. I work with Dr. Rob Thomas, chiropractor, and we share clients, and he has given them and me feedback that when they come and do posture therapy, they need fewer adjustments. Their adjustments hold much longer. And some people, just they don't have to go nearly as often. I also work somewhat with Teresa Valenzuela, acupuncturist, and she's referred patients to me. So,
I have a question. So
Yeah.
is there a billing code?
no, we'll talk about that. Yeah, sorry. So, regardless of diagnosis, if rest doesn't reduce or alleviate symptoms, then traditional medical doctors are going to say you need to go to physical therapy, like I said, and then maybe a cortisone injection, maybe surgery. If you look online, physical therapy is considered the best first treatment option for shoulder injuries. But I disagree. I think the first treatment option should be posture therapy because of what it does. So physical therapists are constrained by a diagnosis provided by the physician and the treatment that's allowed and covered by insurance. Posture therapy does not take insurance. There are no constraints based on what the medical community, established medical community, or insurance community says you can do. So the focus is totally different because of that. People often don't want to pay for posture therapy because it's more expensive. If they have insurance coverage, physical therapy is covered. So a lot of clients come to me and they say, well, if you don't take insurance, I'm not going to do it. They go to physical therapy for 6, 8, 12 weeks. They come back and they say, okay, now I'll pay because that didn't help. So, and posture therapy is not prescription based, although I would love if Lauren Larson and other doctors said, oh, go see Grace. Each physical therapy is given a prescription to physical therapy for a specific issue. So if they came in for a shoulder problem, but you also have a bad hip, your hip hurts all the time, or your knee you can't bend over anymore in certain ways. The physical therapist is only going to address what you came in there with the diagnosis, your prescription. And it's very parts oriented, and the physical therapist that you see in physical therapy is usually often a specialist. Well, you get assigned to this one because he does shoulders, and then you come back in 6 months because now it's your hip. Your shoulder's still bothering you, but you can't get any more therapy, and now it's your hip. You're going to see a different therapist who doesn't have that same understanding of the fact that your shoulder was a problem. 6 months ago. So posture therapy is whole body oriented. We look at the whole body because the body operates as a unit. Everything is connected. Nothing works in isolation. Even your thoughts affect how you're able to move. So there's just nothing that's separate. And so posture therapy now, let's take a little break and go to the bathroom, and then I'll talk to you a little more about what posture therapy is, and then we'll go through some of the exercises and see how you do.